Hi, I'm Drew,
And I'm Mackenzie.
and we're both registered nurses in our respective communities of Eugene and Springfield. We belong to Health and Healing Booth and Community Village, and today we wanted to talk about coronavirus or COVID-19 or SARS-CoV-2 or novel coronavirus disease 2019. These days you can't go far without the reminder that we are in a pandemic. And even though local governments are loosening their restrictions and communities are slowly reopening, it does not appear that we are nearing the end of the public health crisis. So until we can better understand the transmission habits of COVID-19 and or develop an effective vaccine, we need to know how to keep ourselves and our loved ones safe.
First off, let's begin with what we do know about COVID-19. The virus is primarily transmitted or spread through respiratory droplets. That is uncontained coughing, sneezing, throat clearing, and spitting. These all tend to send tiny droplets of mucus or saliva or other respiratory secretions into the air. These droplets contain the virus and act as a vehicle by which they travel and spread. If these droplets land on a surface, either via touching with a contaminated hand or if you cough or sneeze directly onto the surface, it is possible that a person can get COVID-19 from touching that contaminated surface and then touching their own face, eyes, nose, mouth area. These droplets can last from hours to several days depending on the surface. Symptoms of the coronavirus generally include dry cough, fever, that's a temperature greater than 100 degrees Fahrenheit, sore throat, shortness of breath, body aches, and extreme tiredness or fatigue. Sometimes there can also be stomach or GI upset, most often resulting in diarrhea, and sometimes you can also have loss of taste or smell. These symptoms can range from being very mild to severe enough to require hospitalization, and it is also possible to have COVID-19 and never develop symptoms. So you should know that you can spread COVID-19 whether or not you currently have symptoms.
So how can you protect yourself and your loved ones from becoming infected?
The World Health Organization put together a really helpful list, so we're just going to kind of go through that and discuss each one with you. So it is important to regularly and thoroughly clean your hands with either an alcohol-based hand sanitizer, and the alcohol-based is really important. It does have to have alcohol in it, or wash your hands with soap and water. The reasoning behind this is washing your hands or using the hand sanitizer kills the virus that can be on your hands and prevents you from contaminating other surfaces.
Another way to limit transmission and infection is to maintain at least 6 feet between yourself and other people. The reasoning behind this is when somebody coughs, sneezes, or even speaks, they can spray tiny, small liquid droplets from their nose and mouth, which can contain the virus. So if you're too close, you can breathe in the droplets, and including the virus if it's inside those droplets.
Another way you can protect yourself is to avoid going to crowded spaces. Where people come together in crowds, you are much more likely to come into contact with someone who has COVID-19, and it is more difficult to maintain that physical distance that Drew was just talking about. So you want to avoid, as much as possible, places that you cannot maintain that distance.
Another thing you're going to want to try to practice, even though it may be hard for all of us, avoid touching your eyes, nose, and mouth, especially when you're out in public. The reasoning behind this is hands touch many surfaces that can pick up the virus. The virus can be in those tiny droplets that we mentioned before, and they just can land and live on high-use areas like doorknobs, like countertops, etc. And if your hand touches that and then transfers it to your eyes, nose, or mouth, that could be a way or a common way that people can pick up the virus.
Another thing that's really important is that you and those around you Practice good respiratory hygiene. So this means covering your nose and mouth with a bent elbow or a tissue. So don't cover your face with your hands. Use either your elbow or a tissue. And then immediately either wash your hands or dispose of that tissue right away. The reason that you do this, obviously, is, as we already discussed, is droplets is how you spread this virus. So by following good respiratory hygiene, you protect the people around you from the virus, COVID-19, and other viruses such as the common cold and flu.
So another thing to do to help stop or slow the transmission between people is to stay home and self-isolate, even with minor symptoms such as a cough, a headache, mild fever, until you recover. Have someone bring you supplies. If you're feeling ill at all, you need, or if you leave your house, wear a mask to avoid infecting others. The reasoning behind that is avoiding contact will help protect them and even yourself, even if it's not COVID-19, from possible COVID-19 viruses. So yeah, try to self-isolate as much as possible.
If you do have a fever, cough, difficulty breathing, or any of the other symptoms that we have discussed, make sure you contact your healthcare provider. You don't necessarily need to go in, but just give them a call, explain what symptoms you have, and then they can kind of direct you from there. If you are to the point where you have severe difficulty breathing, and you feel like you need hospitalization, you can also call ahead and let them know your symptoms that you believe you may have COVID-19 before going in to an urgent care or an emergency department or anything like that. Calling in advance, this allows the healthcare provider to quickly direct you to the right healthcare facility, and will also protect those people who you're going to come into contact with by giving them some time to prepare and protect themselves.
So keep up to date on the latest information from trusted sources. So we're talking like most of what we're getting from here is going to be from Lane County Public Health, World Health Organization or WHO, CDC, and other local agencies, official local agencies, .govs, things like that. The reasoning behind that is that local and national authorities are best placed to advise on what people in your area should be doing to protect themselves.
So we want to go over, there's been a lot of information coming out about mask wearing. Most communities are recommending that you wear a mask anytime you're out in public, especially if you're unable to maintain that 6-foot distance. And then if you are ill, also wearing a mask is really important. So we want to kind of go over, there's a World Health Organization do's and don'ts for cloth masks. So as you can see here, I'm just going to kind of scroll. So how to wear a fabric mask safely. Clean and wash your hands before touching the mask. Make sure that there's no damage to the mask, like holes or rips, tears, anything like that. Adjust the mask to your face without leaving any gaps. So this is really important. You want to make sure that it's covering your nose and your mouth all the way to your chin, like Drew's showing you there. And you want to make sure that it's pretty fitted. So, you know, you don't need it so tight that you can't breathe, but pretty fitted around your nose and mouth. And then once it's on, avoid touching your mask at all. So that's one of the things, you know, we talked about. You don't want to touch your face, especially when you're out in public. That applies to your mask as well. Clean your hands before you remove the mask. Remove the mask with the straps behind your ears instead of touching that space that could have gotten droplets on it. And then put your mask in a sealed bag to keep it there. Unless it's wet, you know, you want to let it dry. And then always wash your mask in soap or detergent and hot water if possible, at least once a day if you know, with frequent use. And then wash your hands after you are done using it.
So a lot of things that you'll see around the community, especially going to grocery stores where people do wear masks, but maybe they're not doing it correctly. And what we want to say is the don'ts, and that is reviewed here, as you can kind of see. Don't use a mask that has holes in it, right? But that kind of goes into don't wear loose masks. Don't wear the mask improperly. So you'll see folks that maybe are having tough time breathing while they're walking briskly down a sidewalk or whatever, maybe trying to talk to people. It's natural to not want your face covered, but this pulling your mask down so that your nose is exposed completely defeats the purpose of keeping you or even other people safe from transmission of the coronavirus. Don't remove the mask where there are people within 6 feet of you. Do not use a mask that will asphyxiate you. Don't make a mask that is too tight that you can't breathe through. But also on the reverse of that, do not. It's pretty ineffective to wear a mask that is, you'll hear some people talk about the candle test, and it's not talked about on here, but essentially if you could blow out a candle that is about a foot away from your face while you're wearing the mask, then it's not really doing a whole heck of a lot. So people that wear bandanas or thin bandanas or buffs around their faces, they're not really doing much. They're doing a little because they'll still capture moisture, but it's not doing a whole heck of a lot. It's better to have that barrier so that if you were to blow with the mask on, you can't even feel any wind exiting that mask. And also biggest thing, don't share your mask with other people.
One note I just do want to say, if you don't have access to a cloth mask or a medical grade mask, and you only have a buff or a bandana, that's fine. Just make sure you double up or triple up, or put a bandana with a buff over it. Just try to layer. Layers of cotton are very effective, but you do need multiple layers. So to wrap up our video, we wish we had better news for you and more fun things to talk about, but we thought it was important to get some information out on the pandemic that we are currently in. Unfortunately, we do believe that this virus will be around for a while. That's how we feel about it. So we just want to say, keep taking care of yourself, keep taking care of your community, wear masks, wash your hands, keep your distance, and don't touch your face. Together we can get through this.
Thanks, guys. Glad you're thanks, guys. Glad that you're coming to check out our video. We got our resources from the World Health Organization, Centers for Disease Control and Prevention, and then also our state health authority. And these are all resources that you can use as well for yourself. So please do educate others, be up to date.
And we'll see you next year at the country fair.
Yeah. Have a good country
Bye.
fair, everybody.